Hello guys, welcome back to my channel MedicoGyaan, the final stop of all your medical related queries. I hope everyone is good and taking care of themselves. Please subscribe my channel if not done already. Press the bell icon button to receive the further notification. So friends, today the topic of discussion of the class is to study the ultrasound on IVC, which is mainly done to assess the fluid status of the patient. So let's go and study the topic in detail. So friends, what are the clinical indicators which state that the patient is in the need of fluid? The first and foremost is hypotension. Patient can be having a decrease in the blood pressure. After hypotension, there can be associated tachycardia, which means that the heart rate of the patient can be more than 100 beats per minute. In this patient, there can be sustained hypoperfusion. Because of the sustained hypoperfusion, there is accumulation of the lactic acid, leading to metabolic acidosis. And also there is associated decrease in the urine output, which is less than 1 ml per kg per hour. If all these indicators are present, it means that the patient is in need of fluid. Let's study the basics of the ultrasound probe. Basically, there are three kinds of probe which are used in a practice. One is a linear probe, another is a curvilinear probe, and third one is a phased array probe. The linear probe has a high frequency of more than 7.5 MHz. High frequency means lesser depth and superficial structures can be seen. The curvilinear probe has a medium frequency of 2 to 5 MHz. Medium frequency means the depth is more and it helps in the visualization of the deeper abdominal structures. Now comes the phased array probe, also known as the cardiac probe. It has a low frequency of 1 to 5 MHz, which means high depth and cardiac and abdominal structures can be seen through this probe. After learning the basics of the ultrasound probe, let's go and see how the ultrasound is done to detect the IVC size. The probe, cardiac probe, is placed just beneath the Xiphi sternum in the short axis view. After placing the cardiac probe in the short axis view beneath the Xiphi sternum, hyperechoic structures can be seen. One is the inferior vena cava on the left side, another is out on the right side, and just beneath is the vertebral body. To differentiate between IVC and the aorta, what we see is aortic pulsation. After seeing the structures in the short axis view, we tilt the probe in the parasagittal long axis view. The pointer is placed in the cephalic direction. Now we will try to localize the IVC. The IVC can be clearly seen draining into the right atrium. We can also see in the hepatic vein draining into the IVC. IVC is mostly measured at the junction of the right atrium and the IVC, or 2 cm proximal where the hepatic vein drains into IVC. The normal diameter of the IVC is 1.5 to 2.5 cm. Now let's study what is the relationship between the IVC and the central venous pressure. If the IVC size is less than 1.5 cm and it is more than 50% collapsible, it interprets CVP of 0 to 5. If the size of the IVC is 1.5 to 2.5 cm and it is more than 50% collapsible, it interprets the CVP of 6 to 10 mm of mercury. And if the size is 1.5 to 2.5 cm and it is less than 50% collapsible, it means CVP of 11 to 15 mm of mercury. An IVC of more than 2.5 cm and less than 50% collapsibility correlates to the CVP of 16 to 20 mm of mercury, which is a high CVP. After visualization of the IVC, we will go into the M mode. M mode helps to determine the collapsibility index of the IVC. On pressing the M mode, you can clearly see this is the IVC at the bottom of the screen, which is an hyper-echoic shadow. The maximum diameter and the minimum diameter of the IVC is measured. In this picture, the maximum diameter is 2.2 and the minimum diameter is 1.71. So friends, how can we calculate the collapsibility index? It is measured by a formula, which is D max minus D minimum upon D max. This index helps to calculate the respiratory variation and the fluid assessment of the patient, as we have already discussed in the previous page. So friend, this is how we can calculate the IVC using the ultrasound, which is particularly useful to assess the fluid status of the patient. So thank you guys for watching this short video on IVC measurement using an ultrasound. Please subscribe my channel if not done already and press the bell icon button to receive the further notification. Also kindly stay tuned on www.medicogyaan.co.in for my upcoming videos. Thank you.